PCOS has been reframed as something bigger, a metabolic, endocrinological, whole body, lifelong condition. So polyendocrine metabolic ovarian syndrome, and it's been changed. And it got me thinking about what that means for South Asian women and our biology, because our biology is different. And I was thinking to myself, as someone who has PCOS and got misdiagnosed, then what does that mean for somebody like me in particular, and all my brown sisters out there who are still struggling with their diagnosis or might not have been diagnosed properly, but also might have some of the hallmark symptoms, because the diagnostic criteria is basically mostly on white Caucasian patients about 70 years ago, and we've never really moved away from it because we as South Asian people develop insulin resistance at lower BMIs. We store more visceral fat around organs, not under the skin. And we have a heightened androgen response to the same insulin levels. So even when your weight is normal, like me, so you look at me and everybody goes, but you're really slim, how can you have PCOS? My hormones may not be. And that's the difference with us South Asian women, or my brown sisters who are watching this right now. Because clinically what that means is that with PCOS or PMOS, we have an earlier onset, we have more severe symptoms, we get missed and we get dismissed easily. Because the symptoms is still using criteria, as I said earlier, based on a white population. And let me tell you this, it's a white population which is relatively a run-of-the-mill generic population. So if you're brown watching this, like me, and you're told that your bloods are normal, you don't fit the picture, come back when it gets worse, or let's just pop you in the pill without really thinking through that you might have PCOS or PMOS, a whole body inflammatory, lifelong endocrinological metabolic condition, and that you might not fit the picture because you don't have cysts, come back when you want to have a baby. And that sort of rhetoric needs to change, because what we're actually seeing is with PMOS, it's a metabolic dysfunctional driving hormonal disruption. So that means acne, hirsutism, and yes, the joke is that brown girls are hairy anyway. That's not actually true. Irregular periods, you can also have regular periods. You can get hair thinning elsewhere as well. But these are downstream effects. These aren't the root cause. So you have to ask the question differently. So the questions to ask isn't, do I have cysts on the scan, doctor? And is that the diagnosis for PCOS? It's, do I have the underlying insulin resistance? And that's what we need to get better research on when it comes to black and brown communities and women like myself, because yes, I'm a clinician and I've got this, but that's where targeted treatment starts.